Uganda is taking bold steps to tackle pollution through the Environmental Pollution Program in Uganda, also known as EPPUG. This initiative has delivered impactful results aimed at protecting public health and the environment.
The world has over-focused on symptoms as opposed to addressing underlying causes. So until we address the primary causes of the global environment crisis, we shall remain addressing symptoms.
The EPPUG program is implemented by the Global Alliance on Health and Pollution in partnership with National Environment Management Authority, Ministry of Health, Kampala Capital City Authority, and other stakeholders.
So our theory of change encompasses three things mostly. One is to support and to build political willingness, because of course if there is not endorsement and collaboration from the government, things won't be sustainable and can change.
The key components of the EPPUG program include development of the Health and Pollution Action Plan for Uganda, a study on health impacts of traffic-related air pollution around Kampala, expansion of Kampala City's air quality monitoring infrastructure, a civil society-led awareness campaign on pollution and its health impacts, review of Uganda's waste management and agriculture policies with emphasis on gender equality, disability, and social inclusion, poverty and health, a study on economic impacts of pollution in Uganda, a civil society-led training on the safe use and handling of agrochemicals. The EPP program is supported by the UK government through the Department for Environment, Food and Rural Affairs.
It has taken steps over the past 5 years to address Uganda's growing pollution challenges, including, among other things, the passing of the National Environment Act and the introduction of the National Environment Air Quality Standards Regulations. We also know that NEMA has been proactive in leading cross-government initiatives in this space. This framework gives us confidence that we will be able to work effectively with you on pollution control.
One of the program's key achievements is the development of Uganda's Health and Pollution Action Plan.
We developed a preliminary assessment report, but we started this with a number of priorities, including waste management, air pollution, water pollution, contaminated sites, heavy metal pollution.
The action plan is a national roadmap that identifies major pollution challenges and outlines practical and sustainable solutions.
We have a number of regulations in waste management regulation. We have air pollution regulation in 2024, but the issue is enforcing these regulations.
The action plan identified air pollution, indoor air pollution, water pollution, improper waste management, and agrochemical pollution as pressing pollution issues in Uganda.
We generate pollution, and that pollution is not managed properly. The solid waste is not disposed in a right way, and also the liquid waste is not treated to the level that meets the standards before it is discharged into the environment.
KCCA is responsible for waste management as an institution, but the Act specifically indicates that waste belongs to you as a generator until the collector comes.
Pollution is the great killer. Globally, we lose more than 9 million people, which is the greatest number compared to even wars. So pollution is a serious thing. It is imperative to think about what can be done to ensure that to address pollution.
In order to strengthen collaboration and coordination between stakeholders to address pollution challenges in Uganda, Global Alliance on Health and Pollution signed an MOU with National Environment Management Authority.
We do need pollution and health metrics to be integrated into the physical planning, industrial licensing, and agricultural policies of the country.
Let's approach the Ministry of Finance, let's approach development partners so that they're able to give us resources. It is worth resources so that we are able to start moving.
To better understand air pollution, a source apportionment study was conducted focusing on traffic-related emissions in Kampala. The study was implemented as a collaboration between Makerere University and Birmingham University.
So what we want to do is perform low-cost source apportionment to identify and understand the dominant sources of Kampala's air pollution. And we will study distinct locations in Kampala and develop a tool to estimate the typical exposure of citizens on traffic-related air pollution.
This research has helped to identify the major contributors to poor air quality, enabling implementation of more targeted interventions. Results of this study show that vehicle traffic is a major driver of air pollution, particularly during morning and evening peak periods.
It's very difficult to find a place that has very acceptable clean air levels in line with the World Health Organizations. So it shows that we need to take action.
We have issues of indoor pollution where we have rural communities where they still cook indoors using biomass, or where in some cases we have communities where animals reside near homesteads or inside home dwellings. We have emissions from constructions.
In addition, Kampala's air quality monitoring network has been significantly expanded with the installation of 38 monitoring devices. These systems provide real-time data, improving the country's ability to track pollution levels and respond effectively.
Yes, we bought some air quality sensor, and this will be given to NEMA, but currently those are managed by ERCO. And of course, the main scope is that we conduct the air quality study first.
The study also developed a Kampala Air Quality Health Assessment Toolkit to translate air quality data into quantifiable health outcomes, including attributable deaths, life years lost, and new cases of major non-communicable diseases. Public awareness has also been a major focus of the EPP program. Through civil society-led campaigns, communities in the Greater Kampala metropolitan area have been educated about pollution risks and how to reduce exposure, empowering citizens to take action.
More than 30 community-based resources have been reached through this campaign, which was spearheaded by Yadnet Uganda. In the communities where I've been doing monitoring, I've seen CSOs reaching other community-based CSO organizations to come together to address issues of pollution, on waste management, on issues of policy, and engaging the retail bearers.
As Youth Advocacy and Development Network, we built their capacity in monitoring and evaluation. We built their capacity in creating awareness about pollution. We built their capacity in financial management, and in the end, they have been able to reach out to several communities with information on pollution awareness.
The program also reviewed key waste management and agricultural policies, integrating important considerations such as gender equality, social inclusion, poverty, and health. This ensures that solutions are fair and benefit all Ugandans, especially vulnerable groups. Furthermore, studies on the economic impact of pollution have highlighted the financial burden pollution places on the country, strengthening the case for urgent intervention.
We must strengthen coordinated action because we all have a role in reducing air pollution to safeguard the air we breathe.
Finally, training and education campaigns on the safe use of agrochemicals have equipped farmers with knowledge to reduce agrochemical misuse and other harmful practices so as to protect human health and the environment. Together, these achievements mark a significant step forward in Uganda's journey toward a cleaner, healthier, and more sustainable future.